So that's one that I use fairly commonly. After first, asking for a person's common symptoms, getting a food diary, we look at this together. There are different ways that you can implement that diet too. So not everyone has to go through the same really intensive approach. I have had one client that, we only took out apples and wheat bread and test them back in, within a few weeks, she felt so much better. If a person's presenting with really severe symptoms like that, I always will recommend that they seek out, a second opinion. And in some cases, I'm just going to refer them to like a really good GI dietitian that I know, just, for sort of scope of practice and, because they can provide MNT and may be able to collaborate with other practitioners in ways that are best for them. And then in other cases, aside from, looking at dietary modifications to sort of reduce some of the common triggers, looking at lactose intake, it might be appropriate to look at, ways that we can enrich the diet a little bit. So can we add some more fatty fish to increase omega-3 fatty acid intake? There can sometimes be application of certain fiber supplements that are not readily fermentable, but can add mass to the stool and help it solidify. So things like methylcellulose or chia seeds, flax meal, those things can help as well. And I don't rely super heavily, obviously, on a lot of supplements. People are often curious about probiotic supplementation, and there are some justified uses for those applications. So probiotics for use with antibiotic-associated diarrhea, traveler's diarrhea, and some of the symptoms of IBS. But for the most part, supplementation just doesn't really seem to be as effective as like whole diet interventions. And then obviously looking at other lifestyle factors like sleep and stress, because even things like yoga and meditation and cognitive behavioral therapy can help with some of the symptoms of IBS.
Yeah, I could not agree more. And a lot of people, don't understand exactly what that low FODMAP diet is. So fermentable, meaning that anything that we consume, in the carbohydrate family that gets into our large intestine and is not digested, but is fermentable, that means the anaerobic bacteria are going to essentially digest that. And the byproduct is methane gas.